Good afternoon. My name is Allison Martin, and today I'm going to be sharing with you a proposal to implement a new position in the emergency department at Carilion-Roanoke Memorial Hospital. The position is for dedicated emergency department phlebotomists whose primary function is to collect specimens for blood cultures. Carilion-Roanoke Memorial Hospital, or CRMH, is a Level 1 trauma center located in southwestern Virginia. It is the largest of the Carilion Clinic hospitals. The emergency department at CRMH has 72 patient beds and sees approximately 85,000 patients per year. Blood culture contamination has been nationally recognized as a quality issue for decades. Contaminated blood cultures are detrimental for patients and the healthcare system as they lead to patient misdiagnosis, unnecessary patient testing, treatments, and preventable healthcare expenses. The nationally acceptable rate for contaminated blood culture is set at 3%. In the ED at CRMH, staff collected an average of 692 blood cultures per month in 2015 and an average of 715 per month in 2016. In 2015, 5.9% were contaminated, and in 2016, 6.9% were contaminated. This is more than double the recommended rate. Despite staff education in both 2014 and 2015, only minimal, non-sustained decrease in contamination rates has been demonstrated. The emergency department collects nearly half of all blood cultures that are drawn hospital-wide. Blood culture contamination is more frequent in emergency departments, potentially due to high staff turnover, variation in specimen collection techniques, and the time-sensitive need to obtain the culture before antibiotic therapy can be started in septic patients. Emergency department overcrowding can also play a role in higher contamination rates. Much available evidence demonstrates the benefit of utilizing dedicated ED phlebotomists to collect blood culture specimens. Dedicated phlebotomists have been demonstrated to have lower contamination rates. This is likely related to focused education, training, and skill that is developed from repetition and practice. Nurses and other clinical staff are likely to want to collect specimens through IV catheters, which can be more efficient but is not preferred over direct venipuncture. In 2016, the blood culture contamination rate for CRMH phlebotomists was 0.8% as compared to 6.9% in the ED. Cost of a contaminated blood culture is estimated to be $3,700. This translates to $1.82 million in costs associated with blood culture contamination originating from the emergency department in 2015 and $2.19 million in 2016. The potential impact of dedicated ED phlebotomists. The implementation of dedicated phlebotomists will contribute to improved patient safety by decreasing unnecessary testing and treatments, such as antibiotic therapy. This project also has the potential to save both patients and the organization a substantial amount of money. In 2016, there were 594 contaminated blood cultures drawn in the emergency department at CRMH. Each one of these is related to a patient who likely received unnecessary treatments such as antibiotic therapy, testing, increased unnecessary expenses, and potentially an increased hospital length of stay. Contaminated blood cultures have been shown to increase hospital length of stay days by 1 to 8 days. Emergency department overcrowding, largely attributed to inpatient boarders, is also an issue for emergency departments across the nation. The ED at CRMH is affected by inpatient boarders on a daily basis. For 2017, the current average boarding time for an admitted patient is approximately 522 minutes or 8.7 hours. Any ability to reduce hospital length of stay days has the subsequent potential to reduce ED inpatient boarding and ED overcrowding. ED phlebotomist coverage will be a contracted service provided by the independent vendor for all facility laboratory services. Coverage will be insured through contracted agreement Monday through Sunday, 24 hours per day. Coverage will also be provided by the lab vendor for both scheduled and unscheduled employee time off. What are the anticipated expenses related to this project? Carilion Clinic will compensate the lab vendor for services provided a total of $253,000 per year in 12 individual monthly payments. Per contracted agreement, there will be a 3% increase to the monthly payment each year. The lab vendor will be responsible for all wages and necessary training and certifications related to the dedicated ED phlebotomists. The emergency department at CRMH will also be responsible to provide a designated workstation for this phlebotomist. This is estimated to cost approximately $4,000. During the transition period, in which the dedicated phlebotomists are being hired and trained, the emergency department staff will also require education regarding new workflows and processes related to the collection of specimens for blood cultures. This education is estimated to cost approximately $5,480. A cost-benefit analysis demonstrates projected initial benefit to be over $687,000 in the first year. This amount is based on a decrease of blood culture contamination rates from 6.9% to the nationally acceptable level of 3%. Reduction beyond 3% will result in additional projected benefits. Thank you for your time today and your consideration of my proposal. I hope that I have provided you with sufficient information to support this and hope that you will reach out and let me know if you have any further questions. Thank you very much.